shall get started. Good afternoon, everyone. Thank you so much for joining us this afternoon for our Chronic Illness and the Role of Occupational Health webinar. My name's Nicole Core. I'm unable to change my name, unfortunately. On the thing, I'm up there as Medigold Health. My name's Nicole Core. I'm the Marketing Director here at Medigold Health, and I manage our webinar programme. So this is actually a topic that has been requested by a number of our webinar attendees and clients in the past, so I'm delighted that we're going to be able to fulfill that for you this afternoon. I'll run through a little bit of housekeeping. As you may have heard, if you were joined at the start, the webinar is being recorded and you will receive a link to the recording via email tomorrow. So that will come out, so just keep your eyes peeled for that, and feel free to share that link with any colleagues, peers, or whoever that you feel might find it useful. Also, this isn't one of our webinars where it's a commercial product, so we can actually share the presentation slides as well. We say that we do not share the presentation slides. That's when it's more of our sort of neurodiversity training. But with this one, we can share the slides as well, so we'll include a link to them in the follow-up. Just to let you know, you're not visible during the webinar. So I can only see Hayley, Hayley can only see me, and we can see the slides. So don't worry if you want to just kick back, enjoy your lunch. We can't see you. But we would like your input and any questions you've got. You'll see at the bottom of your screen, there's a chat function. Feel free to drop any comments that you've got in there. But there's also, if I can just alert you to the Q&A function. If you've got any questions at all for Hayley that you'd like her to answer at the end, we have got a Q&A section. Please drop them into the Q&A bit at the bottom, and we'll do our best to get those answered at the end. We always make time for that. So without any further ado, I will get started and hand over to Hayley. Over to you.
Thank you. Right. Hi, everyone. Thank you so much for attending. And I'm absolutely delighted to be here to talk about chronic illness and occupational health, a topic which is kind of close to my heart, really. So just a little bit about me. So I work currently as the Associate Director of Nursing at Medigold Health. So I've been a nurse for around 25 years. That makes me sound really old. So yeah, about 25 years as a registered nurse. And I've also got a qualification in occupational health and some additional training in occupational health. I've been working in this kind of remit of nursing for around 19 years. And at Medigold and throughout my career, I've been lucky enough to work in a variety of different industries. So construction, rail, public sector, aviation, retail, you name it. I've probably done it. I've been at Medigold for 10 years and during that time and currently, so we're lucky enough to work with some of the best OH doctors and nurses. So, you know, in terms of my progression for my colleagues as well, we're very lucky, very fortunate here. Prior to occupational health, I had a background in a variety of different sectors. So I worked in cardiac nursing, on the bowel wards, the surgical respiratory nursing. I was a practice nurse for a while as well. So I've kind of got quite a background in chronic illness. And obviously I've been helping to support businesses in managing chronic illness for nearly 20 years now. So hopefully I can give you an insight into chronic illness and how we in occupational health can help you to manage that. So hopefully by the end of this webinar, we'll create a bit more understanding about chronic illnesses, the different types of chronic illness and the prevalence amongst the UK workforce, the impact that has, so not only through absenteeism, but productivity, etc. We'll talk about some practical support strategies for the managers, so and how we can help to support your colleagues, your employees with chronic illness at work. And then we'll talk a little bit about occupational health's role, so how we can help you to support those employees to benefit your organisation. So starting at the beginning, what is a chronic illness? So a chronic illness is defined by the NHS as a long-term physical or mental health condition. So this is a health problem that requires ongoing management over a period of years or decades and is one that cannot currently be cured, but can be controlled with the use of medication and or other therapies. So with chronic illness, often it requires regular medical intervention and monitoring, and these could be routine checkups ranging from weekly, monthly, annual checks with the doctor, and these checks are really important for patients to attend. So they will assess disease progression, for example, in some of the appointments, talk about treatments, adjusting medications, reviewing, starting, titrating, new medications, helps to detect early signs of complications, or gives the patient the opportunity to report any symptoms, new symptoms, ongoing symptoms, or worsening symptoms. Helps to provide sort of the psychological support, if you like, as well for ongoing chronic illness. Chronic illness is has a huge impact on about 8 million people in this country. And I think that, whether you're newly diagnosed, whether it's a long-term condition that you've been dealing with, you are going to need that support, and not only from the doctors and nurses as well. So chronic illness also involves long-term physical monitoring. So people may need to attend blood tests, for example. They may need to attend regular imaging, x-rays, MRIs, frequent blood pressure tests, colonoscopies if perhaps it's a bowel condition, spirometry for asthma and COPD, diabetes. They may need to attend sort of regular foot checks and retinopathy screening as well. So lots of ongoing regular medical intervention, monitoring and treatment. The definition of chronic illness is defined as the effect that it has on a person's normal daily activities or normal tasks, and that includes work. And we're thinking about cleaning, cooking, shopping, walking, sleeping, all of those normal activities that perhaps we take for granted that people with chronic illnesses may struggle with. Whether or not it's a chronic or an acute illness is really important. So an acute illness is more of a sudden onset and often severe symptoms, and these can last sort of days or weeks. An example would be appendicitis or pneumonia, fractured bone. Those types of illnesses would be an acute illness, and they often resolve with immediate medical intervention, perhaps surgery in the case of appendicitis, or you may wear a cast for a fracture. So that's an acute illness. Some acute illnesses, such as a heart attack, may develop into long-term chronic conditions depending on sort of the diagnosis and the treatment that is offered. But chronic conditions are usually over 12 months in duration. They're often progressive, so they worsen over time. Despite sort of medication and other therapies and interventions, chronic illnesses do generally get worse, and unfortunately they can impact, the lifespan and can be life-limiting as well. The effects on the daily activities is something that we monitor in occupational health. So when we do our assessment, we will discuss, how you're managing with your normal daily activities. How's the fatigue and pain? Have you got any mobility problems, joint stiffness, cognitive challenges, brain fog, those types of things. So there is a real focus on how this affects the normal activities of daily living, not just the diagnosis. Okay, so the types of chronic illness. Now, this is by no means an exhaustive list. That we could go on and on and on about chronic illness, but these are the most common types of chronic illness that perhaps you've been familiar with now or in the past. So diabetes can be split into type 1 and type 2 diabetes. This can be confusing sometimes. So type 1 is generally the early onset diabetes, which requires treatment with insulin, or individuals might wear a monitor, for example, attached to their arm and attached to their phone. Type 2 diabetes is more diet controlled and medication controlled. Both still require ongoing monitoring, foot checks, retinopathy checks, those types of things. COPD and asthma, so respiratory conditions, chronic obstructive pulmonary disease, you may have heard of that. These can be really life-limiting. Asthma is often diagnosed in childhood. Some people grow out of it. Some people don't. Some people, you know, will live with this condition for their life. Some people may be diagnosed in later life, still require sort of a lot of intervention, a lot of monitoring, regular spirometry, regular peak flow measurements, reviews of medication. Heart problems, we've already touched on a heart attack, which could progress or be part of a longer term chronic condition such as ischemic heart disease, where the coronary arteries narrow and the heart muscle itself doesn't get the right blood flow. High blood pressure, so lots of people diagnosed with hypertension, and that is classed as a chronic illness, often requiring medication, lifelong medication. Musculoskeletal, so MSK disorders, chronic back pain, fibromyalgia. We seem to be seeing more and more. Fibromyalgia is a long-term chronic condition which causes widespread pain, fatigue, cognitive problems, brain fog, those types of things. Mental health conditions fall under chronic illness, so anxiety, mood disorders, schizophrenia, bipolar, those sorts of conditions. Neurological disorders, epilepsy, MS, migraine as well, interestingly, is a chronic illness, depending on how frequent the symptoms are. Cluster headaches is another one. Autoimmune conditions, in particular, lupus, Crohn's colitis. Crohn's and colitis are actually the most common chronic illness in the UK. And they require an awful lot of monitoring and often IV infusions. So the individual may need to attend the hospital for intravenous medications to help keep the symptoms under control. Quite a lot of chronic illnesses will have flare-ups. So they'll have good days and bad days, or good weeks and bad weeks, or good months and bad months. You know, it is very, very variable, and it's not really a one case fits all. It's you know, everybody's symptoms are different, everybody's lifestyles are different. Osteoarthritis, so this is a joint condition, so where we get bony changes and the cartilage degeneration within the joints. Long-term condition, again requiring monitoring, can affect mobility, cause fatigue and pain, affect sleep. People often wake in the night. HIV is a chronic condition. Some cancers, obviously some can be treatable, you know, with medications or radiotherapy or surgery. Others are long-term and, you know, incurable, sadly. Chronic kidney and liver disease. Chronic kidney disease often requires dialysis. So now, I mean, with advancements, people can have dialysis at home, but previously you'd had to go to hospital, you know, 3 times a week. Alzheimer's and dementia as well require ongoing treatments and therapy and unlikely to improve, sadly. I'll just give you a moment just to have a look at the statistics. So you can see, I mean, these numbers are huge, and chronic illness has a massive effect on work, industry, the economy, not only through absenteeism. So individuals might need to attend, as we've already said, frequent doctor's appointments. They may have flare-ups where they're unable to work. They may have hospital stays, all that can, you know, lead to absences, long-term, short-term. Also decreased productivity, so pain, fatigue, brain fog, the effects on concentration and stamina, for example, that chronic illness can bring, and those people may not be as productive as they are at other times. Again, the symptoms can be very variable. Some jobs or roles might just simply be too physically or mentally demanding. As chronic illness progresses, more workplace limitations might be, you know, might come to the forefront, and people might simply not be able to do that job, sadly, any longer. So we need to make sure that we've got clear policies and procedures in place to deal with those types of situations. You can see there the economic costs are 43 billion annually. I mean, it's just mind-blowing. Okay. So just talking a little bit about workplace policy, legal and ethical considerations. So as we've already touched on, policy is so important, and you may see in our occupational health reports that we ask you to refer to your absence policy. it's very, very important to have clear, defined short-term, long-term, sickness absence reporting, medical capability or medical dismissal, if that becomes a situation for you, to have those policies in place so that there's open and effective communication. It's really important as well to have a clear policy about adjustments and return to work processes. Is a phased return doable for the organisation? Is that something that can be accommodated? Ill health retirement should have its place, certainly in a policy as well, where if the time comes where somebody needed to perhaps draw their pension early because they were no longer able to work, that those processes and policies are in place. We need to make sure that we have a supportive, empathetic relationship, and create that inclusive environment, I think, for the employees, that they feel supported in work. And dealing with a chronic illness is hard enough on a daily basis. And I think that, knowing that you've got that support as well from your colleagues or your manager or your organisation is really, really helpful. Work is good for people. We want to try and keep people at work if we can. It creates normality. It creates a sense of worth. Just giving people the ability to get up and ready and dressed in the morning sometimes can be a real challenge, but if they know they've got to do that, almost keeps them going. Chronic back pain is a real good example of that. So somebody that has long-term chronic back pain, we would always advise them, look, keep moving, keep going. The moment that you perhaps take to your bed, or you're really, really struggling, you see that your whole life kind of can crumble. So the message really is to, keep going, keep doing what you're doing. We need to have effective communication with our employees, obviously, about the conditions. However, we need to be aware that we have to respect confidentiality. Some employees may want to talk about it till the cows come home. They might be happy to, discuss their symptoms and how they're feeling. And for them, that is really important, and to get other people's views and, validation almost. Other people will not, and that is absolutely fine. We need to respect that autonomy and give people a choice whether or not they want to discuss their health conditions. Some of the symptoms might be embarrassing. For example, they might not want to have, if they need to have frequent toilet breaks, those sorts of things might be embarrassing for people to manage. Endometriosis, as well, people may need to shower, they may need to, and sometimes they don't want to talk about those things, and that's understandable. Or perhaps if they've got, a manager that they don't have that close relationship with, they might want to keep those things private, and we need to respect that. From a legal point of view, now, occupational health cannot give a definitive cause, for disability. So we cannot say to you that the Equality Act would definitely apply. What we can say is that it may apply. And if we just think about disabilities in general, the impact of the daily activities is key here. So the Equality Act states that a disability is defined as a physical or mental impairment that has a substantial and long-term effect on a person's normal day-to-day activity. So again, we're thinking about washing, dressing, sleeping, walking, cleaning, housework, those sorts of tasks. It may have or expect to last for more than 12 months. So those are the key factors when understanding whether the Equality Act would apply. Now, only a tribunal or a legal situation will be able to definitively define, and that requires
We've lost you, Hayley, or is it me?
back.
You're back. You're
Am I
back.
back?
Yeah, you just froze very briefly. Yeah, you froze very briefly there.
Sorry. So I was just talking about the Equality Act and the fact that it's a decision for a tribunal rather than an OH one, but we can give you information that may help, decide whether or not you need to make reasonable adjustments. There are some cases or some conditions that will automatically fall under the Equality Act. So some types of cancers, HIV, MS, for example, they will be fall under the Equality Act from the point of diagnosis. So those ones are almost easier to understand from a legal point of view. Just go one more point on the Equality Act. So another defining feature would be if we withdrew medical intervention. So if we withdrew the effects of medication, or we took away the treatment options, what would happen to the individual? Would they be, more severely compromised on their day-to-day activities? That's another really good point to consider when kind of assessing for the Equality Act. And all of those things we will do during our assessment, so that we can give you a rounded opinion on whether we feel it would fall or not. Okay, sorry. So, effective management at work. So the most important thing, I think, is to create an inclusive and understanding workplace culture, and compassionate support is key. Communication, we've already said, empathy and understanding. Sometimes people just want to be heard. They're battling, with a long-term condition which is affecting everything they do on a daily basis, and it can be a real battle. So having somebody that you can talk to, that can be open and understanding and empathetic of the needs, and you may not understand what they're going through, but you can certainly try to empathize, and I think that's really important. Individuals with chronic illness at work need to practice self-care. So these are the types of things that they will be offered through their support systems. They may have developed some meditation or breathing exercises that they use when they're in pain, or that they're suffering from a particular mental health symptom. They may need regular rest breaks to help accommodate fatigue. They need to keep well hydrated. Some conditions will have strict meal times where they need to be making sure that they're eating or taking diet, and they will only be able to have certain types of foods. So the ability to prepare those foods as well is important. They will generally know what their individual responsibilities are, and they do have obviously a duty to make sure that they are complying with their treatment regimes. Medication schedules are really, really important. So often, people will take medications perhaps morning, lunchtime and evening, and spread those out throughout the day. Other medications, for example, may need to be taken before bedtime. Some will involve hospital treatments, IV infusions, regular injectable medications. Some people will do that themselves. Others will need help and support, and they may go to their practice nurse or their local hospital to have those treatments. At work, implementing a buddy system can be really helpful. So having a colleague or a confidant, that somebody feels able to talk to, just if they're having a bad day, or that, they're having a flare up, or somebody that they can reach out to if they're struggling is really helpful. Again, this needs to be on their terms. Is that something that they want? We don't want them to feel that, perhaps colleagues were prying into their medical history and things like that. But, if they're looking for support, this is a good thing that we can put in place. It's important to understand, when to refer to OH. So do you need that independent view? Perhaps the health issues are affecting their work, or their performance has deteriorated, or that there are concerns around safety. So we can help to advise on, if somebody is fit to do a particular task. And again, these conditions are progressive, things can change. So it's important that you have regular dialogue and regular one-to-ones. They may be having frequent time off, their absence levels have gone up, or they've met your trigger levels. They may be returning to work from a long-term illness or extended hospital stay, and you want some advice on a return to work plan, or a phased return, or reasonable adjustments in the workplace. What is really important is staying connected with the employee during the long-term sick leave. So they are still an employee, they still want to feel valued and recognised, and it's important with their consent, obviously, that you reach out to them. They are an employee, so they have a duty as well, to keep you updated with what's happening and how they're feeling, and likely return to work. we do often see people who are on long-term sickness absence from work, and we can offer some, advice, write for medical reports if needed, to get further information on prognosis and likely return to work date. What we can also do is to discuss, we can discuss medical capability. So that's, if perhaps somebody sadly was unable to return to work, we could, help you to implement a referral in that respect as well, alongside your policies. Sorry, right. So workplace adjustments and accommodations. So as we said, the Equality Act instructs us to make reasonable adjustments. Now, what is reasonable is always going to be a management decision, whether or not that can be accommodated. So the types of reasonable adjustments you could look at would be flexible working hours and schedules, and these could accommodate, medication or doctor's appointment. For example, somebody might need to go every week if they're taking a blood thinning medication for a long-term heart condition. They may need to go and have blood tests every single week on a Monday at 9 o'clock. So having some flexibility around those schedules or start and finish times will be helpful, especially to accommodate fatigue as well. So people may not have slept well, for example, and they might be struggling in the morning. So the ability to start a little bit later, perhaps some days, would be helpful. We need to look at the ergonomics and the comfort, workstations, DSE assessments, and again, remembering that they're progressive conditions and things can change. Regular rest breaks, modifying the workload. If somebody's suffering from brain fog or, reduced concentration, they might not be able to work at the pace that they used to be able to. Symptom management, keeping medications nearby in a drawer, staying hydrated, and meals we've already touched on. Stress can have a huge impact on chronic illness, and carrying out stress-based risk assessments can be really helpful to make sure that people are not feeling too stressed at work, to help them manage their work-life balance. They may need time off for medical appointments or ongoing investigations. Sometimes we will get asked in occupational health, should the absence triggers be raised? Now, that is not an OH decision, that's a management decision. We may, for example, let you know that they could have more frequent absence from work. That is, common with chronic illnesses. Often people do need additional time off, but that will always be a management decision as to what can be accommodated. We can help you with more specific adjustments, role conditions, specific adjustments. One that springs to mind, for example, would be epilepsy. People with epilepsy may not be able to work in specific environments. We can also advise on fitness for specific tasks and safety. Working at height, working in confined spaces, for example, is not always ideal for people that have got chronic lung conditions. And as I've previously said, risk assessments are really important, and making sure that they're regular and that they're updated frequently. Okay. So the types of risk assessments, and sometimes you will see that we advise this in our reports, but obviously there are health and safety laws, the Health and Safety at Work Act, and the management regulations that will say that risk assessments need to be completed by the workplace anyway. Pregnancy in itself, not an illness, not a chronic illness, but someone with a chronic illness who becomes pregnant, they may see an exacerbation or a worsening in their symptoms. So that is really important. And obviously the provision of pregnant worker risk assessment would need to be carried out. Work-related stress, we've already touched on. The HSE have a really, really good template for work-related stress. Stress is not a medical condition, but it can lead to chronic ill health, so anxiety, depression, psychological health symptoms, those sorts of things. So it's important that we put risk assessments and control measures in place. Somebody who has perhaps poor mobility, osteoarthritis or chronic back pain, they may need a risk assessment to assess their ability to get out of the building quickly. So access and egress in an emergency situation. If there was a fire, how are they going to get out? They're not going to be able to run. They're not going to be able to get out quickly. Do they need a buddy? Do they need, a support system in place? DSE assessments, obviously there's regulations. The DSE regs 1992 people with chronic illness would need regular DSE assessments. Do you need a change in equipment? Are you comfortable? Do you need perhaps a standing desk? Do you need to take breaks away from your screen to help accommodate any symptoms, to move around to help avoid stiffness and discomfort? Manual handling risk assessments are really, really important. And we need to consider controls for people that have long-term musculoskeletal conditions. So do we need to split loads into smaller amounts? Do we need to change the task? Do we need to avoid repetitive tasks or bending, crouching, lifting, those sorts of things? Lone work has its own legislation. For chronic illness, it's really, really important in epilepsy and diabetes. So the risk of a seizure or the risk of a hypoglycemic attack, those types of people probably shouldn't lone work, depending on the severity of their symptoms. And first aid, mental health first aid and escalation, what do you do if somebody's having a crisis? Is there any support that we need to put in place or control measures that we can think about? Okay. So other considerations, you may already have, in place some other avenues of support. Lots of the charities, the websites, so Epilepsy Action, Mind, Diabetes UK, there's so many, Crohn's and Colitis Foundation, they provide on their website a wealth of information, and quite often we will link those in our reports. There's actually sections about how to manage chronic illness at work. What can employers do to support individuals? Epilepsy Action actually advises a seizure action plan, and there's an example on there, which is brilliant. What to do if somebody has a seizure, because quite often people will panic, and it's totally understandable. It's an emergency situation and it's quite scary. So, having a plan in place, what to do if somebody has a seizure in the workplace, is really helpful. So I would certainly recommend all of the charity websites linked to all the individual illnesses. They also offer manager employee training and support, and so do we at Medigold. So we can do chronic illness coaching to support the managers to support the employees with chronic conditions. We also have an access to lots and lots of resources. So we have obviously webinars, health information leaflets. We have an on-call duty clinical manager who is completely free service to our clients. So there is a senior nurse on call every day between 9 and 5 for any queries or questions, or if you need any help with a management referral, or you've got a case and you just don't know what to do. It's a really good resource, and tap into it because it's free. It's run by nurses who have done this for a long time, so they've probably been there, done it, seen it, got the t-shirt. So they will be able to offer you, some support and advice, certainly. So other avenues of support, so you may have cash plans in place, and these can help prevent chronic illness, I think, as well. They encourage people to go to the dentist or get their eyes checked, and an optician can often identify a chronic illness just by looking at the back of the eye. So it's not just about your vision. Dentists, same sort of thing. EAP, so employee assistance programs, is there access to counselling or any other support mechanisms people can tap into to help support their well-being? There needs to be a whole holistic, I think, approach to managing chronic illness, not just at work, but the family are involved, friends are involved, the doctors and nurses are involved, and it needs to be a whole kind of team effort. Private healthcare can help to expedite any investigations. If somebody was having symptoms and hopefully they won't get diagnosed with a chronic illness, but access quickly to medical intervention and medication can help reduce the severity in some of the symptoms. And ongoing physiotherapy, alternative therapies as well, dry needling, acupuncture, reflexology, massage, all of those things can help manage long-term symptoms. So how can OH support you? And I know I've mentioned a few times on, throughout this presentation, how we can help support you, but the management referral process is kind of a good starting point. The duty manager is there to help you structure any questions. So what you put into a management referral is what you get out, and there needs to be appropriate consent, needs to be open and effective communication with the employee. When they come to occupational health, it shouldn't be a surprise. All that information should have been shared with them. You should have had those conversations with them, to discuss capability if that's, the road that you're choosing to pursue. The questions need to be structured so that you can get the best answers. You don't have to stick with the questions that we've got, the 8 questions. You can add in your own questions, which can sometimes be helpful. Telling us what you can, and more importantly, what you can't accommodate at work is really helpful. Then we won't be recommending adjustments that cannot be supported from a business point of view. We have the ability to form an aid memoir for our clients so that the nurses and doctors can have a look and see what adjustments are available for employees or what additional services might be available, so that we can help to signpost. We can't diagnose, but we may come across, and it happens a lot, to be honest, we may come across somebody who's, mentioning some symptoms that are ringing alarm bells that they haven't spoken to their GP about. So we can signpost them to go to their GP. Have you thought about X, Y, and Z? Have you thought about getting some additional help? So we're not there to diagnose, but we can certainly signpost. We can help you to implement adjustments and maybe advise on some adjustments that you haven't thought about. We can talk about job modification and functional capability, and the effect on normal activities is really important. We use a biopsychosocial model. So we go through the whole of somebody's, day-to-day activities to see what impact that may have on their workplace. We can act as an advocate for employees with disability, and promote trust between employers and managers, employees, all the stakeholders involved. We can help to sort of elevate those relationships, and that an employee will feel valued and that they feel, important, that somebody's listening to their needs. We can talk about ergonomic advice and workplace adjustments. We've got a specialist team, so we have a workplace adjustments team that can give more practical advice, hearing loops, or further adjustments that might be useful for you in the workplace. We can help to support your compliance and safety, so legal compliance in terms of the Equality Act and, safety of employees at work. Are they actually fit to do that job on that particular day because of their, medical history? So I've just added this last slide in here. So some chronic illnesses are caused by work, sadly, and we don't want to be making people unwell through their work. I mean, you can see the numbers there, 33.7 million days lost due to work-related ill health. Stress, depression, anxiety, back pain are, up there. They are the number one with work-related ill health. However, there are other work-related ill health conditions, COPD, for example, occupational asthma, so people who work with respiratory sensitizers, isocyanates, flour is the number 2 cause of occupational asthma in the UK. So anybody that's exposed to respiratory or skin sensitizers, chronic dermatitis, those sorts of things. Noise-induced hearing loss is another chronic illness, and there is a legal requirement for anybody that works over 85 decibels to be provided with hearing protection and with health surveillance. So we offer lots of health surveillance and fitness for work medicals, so to monitor the employee's health, to make sure that work is not causing them any problems. Some of those are legal requirements, and we can help you to do a needs analysis to see what is required, what's a nice to have, what should we be doing, and what legally do we have to do. And that helps to support your compliance as well in the workplace. And I'm at the end.
Yes, fantastic. Let me just stop sharing actually, because we'll come to some questions. Just want to say thank you so much, Hayley. I learned so much as well. I was just glued to that. So that's so many chronic conditions that I hadn't even thought about that came into that category. So that was so helpful, and hopefully our audience found that as helpful as I did. And we've had quite a few questions actually, so I'll just scoot through these. Thank you so much as well for those of you that have sent questions in. There are a couple that are sort of case related, case specific, so we'll take them offline if that's okay.
Yeah, no problem.
But there's a general, let me just have it. Oh gosh, they're coming in thick and fast now, actually. So as in general, so with occupation, can occupational health assume that employees with chronic illnesses, either physical or psychological, it's likely to worsen and that they may have additional factors and social factors that may
So,
impact them?
yeah, absolutely. So with any medical condition, it is difficult to, predict what will happen. And there are lots and lots of factors involved. We can give you an idea. We can look at, the rate of progression, what's happened over the last few years, that type of thing. We don't have a crystal ball, unfortunately. It would be great if we could predict, but we can give you the likelihood of their, future performance or their future attendance at work.
Thank you. Just going back to one of the risk assessment elements, how would you advise that somebody covers lone working versus working from home, or is it kind of one and the same in a sense?
It kind of is. Yeah, it kind of is. I suppose when we talk about lone worker, we focus more on industry. Is somebody, do they need a radio? Do they need to contact somebody? Have they, are they likely to have a seizure? At home, people will often have their own their own strategies in place. They've been dealing with these conditions for a long time. They may have somebody at home that they can contact, if they need to. But the same applies. We should still be doing a risk assessment to see what controls are in place and if we need to put anything else in place to support them.
Thank you. We've got a few sort of condition related ones. Somebody's asked if tendinitis, could that be ever classed as a chronic condition?
Possibly, depending on the effects on of normal activities and the longevity of the symptoms, it could possibly. Never say never. I would hope that there would be treatments offered for tendinitis. So, anti-inflammatories. There's lots of self-care you can do. Ice, rest, steroid injections, things like that. So there are lots of treatment options to consider for tendinitis. But yeah, it could be if it's long term and affecting normal activity.
Okay, and somebody else has asked about osteoporosis, and please excuse my pronunciation, osteopenia. Are they considered chronic illnesses, and would they be valid to request OH support? And I guess
Yes.
that actual broadly, I guess any kind of conditions are.
Yeah. Yes,
OH.
definitely. In my opinion, they would be, again, dependent on the longevity of the diagnosis and the symptoms and the effect on the normal activities. But, if somebody's struggling at work or, they need additional support, absolutely.
Fantastic. Sorry, I'm whizzing through. There's lots of questions coming in now. Thank you so much. Should we expect occupational health to be able to give an objective opinion on whether someone can continue to do their job in the long term?
Yeah, so we need to be impartial in occupational health, which is something that I probably didn't touch on. So we need to be in the middle. We need to give our view, based on clinical evidence of that employee's ability to fulfill the remit of their role. And that's kind of where we give that objective opinion. Whereas if you got a letter from somebody's GP, for example, it tends to be a little bit one-sided. So we sit in the middle, we look at all the evidence available, and we can give you that opinion.
Okay, thank you. Somebody's asked as well about occupational health support with dyspraxia. Would that be as well? This person, thank you for sharing this. They're not really sure how it impacts them, but it impacts them. They have got problems with processing movement, makes them feel slow down and fatigued at work. What would
Yeah.
suggestion be?
Absolutely. We can also do more specialist assessments. So, if they're, perhaps haven't had the support in the past and they might want some additional help, we can certainly look at that. Workplace adjustments of the team are very good at dyslexia, dyspraxia, those type dyscalculia, all of those sorts of conditions. So yeah, absolutely. We could probably think of things that you might not have considered, or that the employee might not have, even considered for themselves. So yeah, absolutely.
Fantastic, thank you. Again, there's sort of condition related ones. So with regards to things like ME and fibromyalgia, and going to occupational health, and is there any kind of treatment for those that people should be expecting to see?
So it's more of a psychological support that's put in place for ME, chronic fatigue, and fibromyalgia, similar symptoms. The specialists will hopefully signpost to the more psychological support and strategies to manage those underlying symptoms. There are also physical symptoms, obviously back pain, joint pain, widespread pain, that can have medications, pain relief. There are lots of treatments out there. With fibromyalgia, it's a very long, and ME, to be honest, it's a very long process to diagnosis, because it presents in such a way where there's so much going on, that often it takes a while to get to that diagnosis. But once you're there, there are treatments.
Okay, thank you. Somebody's asked quite an interesting question. Do occupational health referrals and reports have an expiry date? So
Good question.
that when open communication may have broken down slightly, and
So
yeah.
I would say that if the information remains relevant, so if nothing's changed, or there is no expiry date, if you like, but if you've got a report that's a few months old and the symptoms are the same, the job's the same, nothing's changed, then I would say you could still confidently use that advice. When things change is when you need to seek another opinion, and that's where structuring the questions comes in really important, because you don't want to be getting the same answers that you got last time. So open communication between the employee, they do have to consent. So if the communication's not there, that probably needs to be resolved before the occupational health assessment is made, or a repeat assessment is made.
Okay, thank you. Sorry, I'm just scrolling through because there's quite a lot in the chat. I'm just trying. This is quite specific, but hopefully you might be able to just shed a little bit of light on it for this viewer. I have a gent who's had 2 heart failures within 2 days. Oh dear, 3 blocked arteries, and went on to have a stent. So he's got 30% function in his heart. As an employer, how can I best support him? He's not been back to his consultant as of yet, so don't want to refer him until he's been back to his consultant. Is there any sort of recommendations you can give there, Hayley?
So I mean, a lot of factors to consider there. Obviously, what his job is. If he was in a physical job, I would say that he would need to be, perhaps put on light duties. We don't like that term, but sometimes it applies. If we have a job description, we can be a bit more specific about what duties they should avoid. It sounds very new, like this has happened quite recently. If he's waiting to go back to his consultant.
I presume so, yes. I mean, that's literally, we haven't got that
Following a
information.
heart attack, they will often have cardiac rehabilitation. So the ability to attend those appointments is really, really important. And they go through everything, diet. So what I was talking about, additional resources. So they go through diet, exercise, what foods to avoid, what foods are good, building up that stamina following a heart attack, what to do after a stent, because you'll be on some medication which thin the blood for a while. So there's lots of things to consider, but I would say that he probably needs rest and recuperation. He'll be on a program of cardiac rehabilitation for a number of weeks. If he's in a physical role, he may benefit from a phased return, or to reduce some of those physical duties. And then when there's more information from the consultant that's really useful, come through to occupational health, and we could advise further on sort of the longer term adjustments if required.
Fantastic, thank you. That's a great response. Somebody's asked about nerve and neurological damage caused by vitamin B12 deficiency. Could this be considered a chronic illness?
Yeah, again, dependent on the symptoms and the daily impact that has on the person's ability to do their normal activities, and the longevity of the symptoms. Yeah, absolutely.
Okay, thank you. What happens if an individual refuses to take part-time or reduced hours whilst they are less than 12 months in employment, but has accumulated frequent absences due to psychological health conditions?
So that becomes a management issue, and that is where policy is so important. So having a clear policy, sickness absence, long-term, short-term, medical capability is really, really important. Ill health dismissal is really important. Ill health retirement, if that's relevant. Policy becomes so important.
Okay, thank you. Somebody's asked as well, picking up on your points about the duty clinical manager. So if any of our you are a Medigold customer, is it worth speaking to the duty manager before referral of the adjustments you have already put in place?
Yeah.
If you can do this, will it help us result in us helping us make management decisions?
Yeah, absolutely. I would also include that information in the management referral. So whoever gets the nurse or the doctor who's ever doing that consultation can see exactly what's been done already. You know, perhaps it hasn't worked or it hasn't helped. So that's really useful information to have prior to an appointment.
Okay, thank you. Oh, we've got a lovely note here, actually. It's not so much a question, but from Alison. Thank you. Alison was referred to OH in 1999, was initially very anxious that her employer would use it to get rid of her. She got undiagnosed Lyme disease, but in fact was very supportive and able to phase return to work over the course of 12 months. I didn't return to full-time hours until 2003, but can honestly say that the OH intervention was invaluable for justifying my need for reduced hours initially. I would encourage anyone with chronic illness to submit to the process. Thank you,
Yeah, that's
Alison.
great. That's great to hear. And, you know, specific cases like that is amazing. You know,
Yes.
that's why we do what we do. As nurses and doctors, we care about people, you know, we
Oh,
do.
yeah.
But we're also very aware that we, you know, are there to advise the business on the next steps. So we remain impartial, but we care about people, you know. So that's a really good example. Thank you.
Yes. Thank you so much. Do you have any advice for employers who need to purchase specific items to support a member of staff with adjustments? Some of the equipment can be expensive, but have you
Yeah.
got?
So we wouldn't usually, and I say usually, there might be some occasions where we would advise a specific sort of piece of equipment, but we're very careful not to for that exact reason. Employers have, you know, their own budgets, their own procurement departments, their own preferred suppliers, you know, which is why we won't put in Amazon links or, you know, you must buy this, you must buy that. And also the employee then feels that they have to have that piece of equipment, whatever that may be, a screen reader or a hearing loop or whatever that may be. So yeah, we're really careful not to advise specific. We may give you a general overview. So for example, I might say that somebody needs a higher back supportive chair with a lumbar, adjustable lumbar area with arm rests. I would describe the piece of equipment. And then Dragon software is another one. We try not to say Dragon because it can be very, very expensive. But, you know, there's lots and lots of different, suppliers now. And it would be for the employer to shop around and to find what's best. We will, of course, if you wanted us to, we will. But we try not to for that reason.
No, that makes sense. Thank you, Hayley. A few people have asked in the chat and the questions, actually, this is just an open answer about the duty clinical manager. What I'll do is in the follow-up email that you get from this webinar, we'll have a link to this recording, but I'll also pop in our little information sheet as well that shows you how you can get in touch. It's usually via relationship manager, but it shows you how you can get in touch with our duty clinical manager, and it is a really helpful service. There's quite a few sort of specific case ones. As I say, we'll pick up with those independently because some of them are quite detailed in terms of on a wider call. But I think that's pretty much covered the themes that have come through, and we've just got lots of thank yous as well. So
You're
yeah,
welcome. Thank you for
Hayley.
listening.
Yeah, no, it's
As
very pleasure. It's certainly a pleasure listening. Yes. So thank you so much, everyone, for tuning in. Please watch out for the email. As I say, it will have a link. It will have some details in there as well to the duty clinical manager. And yeah, enjoy the rest of your afternoon. And thanks again, Hayley.